So, friends, today we will discuss another important topic in History Station, diabetes. So, first we have to start taking history with onset, how it has been diagnosed. It could be because of the polydipsia, polyuria, polyphagia of the patients and increased urine frequency, or could be dehydration, or patient may presented with diabetic ketoacidosis. How it progress and how long this patient is suffering from diabetes. Any aggravating factor, particularly sudden growth spurt during puberty, stress, infections are frequently associated. Relieving factors, any medications, associations. Diabetes is very commonly associated with celiac disease, hypothyroidism, cystic fibrosis, any other autoimmune disorders. Complication could be diabetic ketoacidosis, acute complication, and long-term complication could be chronic kidney disease, any eye disorder, neuropathy. Important negative history you have to take in relation to GI system, cardiovascular system, and respiratory system. And you need to inquire about how is the wee and poo. Past history, history of similar episode, history of previous hospital admission, prehistory of ICU admission due to decay or a hyperglycemia, any past surgical history, investigations. You have to inquire about what is the latest HbA1 C level, is there any glucose or ketone diary maintained or not. These two are very important. And how is the treatment? You have to ask about the whether this subcut insulin is taken or not, how much is the compliance, and is there any side effects there or not because of insulin. Common side effect is hypoglycemia and fat necrosis, and how the insulin is taken either by a subcut route or subcut injections or via pump. And you need to ask about whether the patient know about carb counting and sick day rule, and what are the consultants associated in terms of follow up things. That basically diabetes is a multidisciplinary management, uh, comprises of diabetic specialist doctor, dietitian, diabetic nurse, psychiatrist, general practitioner, and general pediatrician. You need to ask about the birth history and immunization history. Nutritional history is very much important, whether the patient is on diabetic diet or not. And development history, you have to take brief development history. And pubertal history is very important, and how is the growth. And allergy history, family history of similar illness, any major illness, consanguineous marriage, and you have to draw the family tree and how is the family dynamics. Social history is very important in terms of how is the academic going on, is there any bully at school, and how many school days lost, and who is giving insulin at school. Maybe some nurses are there who is giving the injections at school. Is there any medical alert, or how is the condition at home? Is there any education healthcare plan or any social support the child is getting, and how this problem affecting this child's life, and how this problem affecting the family.